Hello and welcome to the Growing Healthy Families podcast. I'm your host, Dr. Scott Haggerty. On this show, I interview the world's top health experts so that you can know with certainty what it takes to give your family a life of epic health and wellness.
As parents, we don't want to see our kids struggle. I knew that he had the potential, and I knew that something needed to be done.
It was hard. We would get frustrated. We didn't know how to deal with it. I was more emotional about it.
Sure that, we're here. Amen to that, brother. Amen to that. Welcome to the Growing Healthy Families podcast. This is Dr. Scott Haggerty here with this handsome young man, Dr. Stuart McGill. And I am super excited for each of you to hear this episode today because I have a very specific reason why I wanted to invite Dr. McGill onto this podcast. Because personally, Dr. McGill's methods saved my back. I am a lifelong athlete who's dealt for a significant portion of my life with back injuries. I was a powerlifter, bodybuilder, impact sport athlete, wrestling, football, and I dealt for a number of years with some pretty significant spine pain. And now, obviously, in my life as a chiropractor, I had to find ways to protect my spine so that I could continue to enjoy health and fitness. But the McGill method is the thing that I found that was the key in stabilizing my spine. And in turn, it became to what I taught all of my patients here in my practice for many, many years, so that whether it's young athletes or adults, so that you know these principles that are critical to being able to protect your spine, both short-term and long-term. And if you've dealt with a back injury, you're going to really want to pay attention to this, because what he's going to talk about are really the keys for you being able to protect your spine so that you can get to higher and higher levels of activity as you move on. So a couple of reasons that this is really critical, because moms and dads, many of you may not know this, but more people suffer with low back pain at some point in their life than any other disorder. 75% of all people will deal with a spine injury at some point. So, Dr. McGill, I thank you so much for being here, because your expertise is something I think that is really changing the way that that the world perceives back injuries, and the research that you've done is really critical into changing people's perception of what spine safety looks like. So thank you so much for being here today.
Well, thanks very much, and good afternoon, Scott. I'm really looking forward to this. So thanks for all that you do.
Well, thank you very much. So let me tell our audience a little bit about you. So to set the framework here, Dr. McGill is Professor Emeritus at University of Waterloo in Canada, where he was professor for 32 years. His laboratory and experimental research clinic investigated issues related to the causal mechanisms of back pain, how to rehabilitate back pain people, and enhance injury resilience and performance. This produced over 240 peer-reviewed scientific journal papers, many international awards, and has mentored more than 40 graduate students during his scientific journey. Dr. McGill is the leading authority in the world in the field of back pain. He is the author of multiple books on back pain and spine fitness, including Low Back Disorders, Evidence-Based Rehabilitation, Prevention, and Rehabilitation, which is also sitting here on my shelves. Ultimate Back Fitness and Performance, which is also on my shelves. Back Mechanic, the step-by-step McGill method to fix back pain. Gift of Injury, the Strength Athlete's Guide to Recovering from Back Injury to Winning Again. So, Dr. McGill, I feel that understanding how people injure their spine is critical in injury prevention and recovery. In your research, what have you found to be the most common reasons for spine injury?
Well, that's a huge question, Scott. So I'll try and answer that in several layers. And if I could rephrase the terminology away from injury for a moment and say, what are the common reasons to get back pain? And if I can talk about pain pathways, it opens up a better discussion. So every system in the body requires movement for health. That's a starting principle. And every system in biology has a tipping point. In other words, there's always an optimum level. More is not better once you cross the tipping point. And if you're under the tipping point, you're leaving some potential on the table. So let's take load. I load my body. But what is load? Load is the magnitude. It is the duration. It's the repetition. And we get into tissue properties. So now the direction of the load matters, the rate of application matters. It's quite complicated, but this is all mitigated by rest and adaptation, because load stimulates adaptation in the body. And if that is below the tipping point, it's anabolic. You build your body, you build robustness to be pain-free and really have fun doing the things you want to do. Or if you cross the tipping point with that exposure, it starts to tear down. You build up cumulative trauma. And, you know, there are those who argue, oh, well, the MRI didn't show any reason why they have back pain. And I said, really? Well, you show me the MRI and I'll show you we'll get right down, magnify, and couple that with our physical exam, and we'll hone in on, with some precision, what the mechanism of pain is. So cumulative stress, and I'm talking about mechanical stress, just like if I took my shirt, for example, and it's made of fibers, it's a fabric. I wanted to work the fibers apart. I would create stress-strain reversals and allow them to accumulate, and finally they would delaminate, and I would cause a hole in my shirt. Well, discs in your back are not ball and socket joints. They are made up of collagen fibers that are held together with a gooey ground substance. So they behave as an adaptable fabric, which means there are certain repetitions of certain loads that cause them to work apart and delaminate. And if a person has a disc bulge, which will be a familiar term to your listeners, then that's exactly what must have occurred. The collagen delaminated and allowed the pressurized nucleus to seep through. But there's all sorts of pathways there. But another feature of that, in order to adapt the collagen adapts either to become very mobile. Say you wanted to be a yoga master and really enjoy the mobility. You will sacrifice load-bearing ability if you create too much laxity. Conversely, if you wanted to be a power lifter and really have the ability to bear supreme load, you must stiffen the collagen, because the nucleus, which is a gel inside the disc, becomes pressurized and it acts like incompressible hydraulic fluid. And you can see as I squeeze this joint how the disc flattens and bulges just a little bit. So the stiffer the collagen, the more load resilient it is. But most people in life don't want to be the extreme of mobility or the extreme of load bearing, because, you know, there are power lifters and they struggle to tie their shoes. Is that really the state of adaptation that you want to create? Well, fair enough. If you're a power lifter, you will, and that's the price you pay. But most people want to be somewhere in the middle. Now that's where the challenge occurs and the real expertise relies. So you mentioned you were a wrestler, and was it football you played? If you said a collision sport, I'm assuming. I'm assuming that because you're a boy from Ohio, and I know football in Ohio is king. But anyway, those are both examples of you have to be somewhere in the middle. And if you adapt your body one way or the other, and then expose it to the opposite load, you tend to get cumulative trauma and pain. Here's another feature. We're all a bit different. There's, yes, we're all humans, but consider a thin branch. And if I wanted to bend a thin branch over and over again, there's no problem. Take a willow branch. It won't accumulate stress and damage. But take a thicker branch and bend it to the same level, and it will break and shatter. So it's a much stronger structure in compression and tension, like a thick spine is, but it doesn't withstand the bending because it creates too much stress to bend a thicker structure. So you're starting to see now how people's body types lends them to be more resilient to certain things. And that's why people gravitate to certain types of sports and not others. Not everybody can be a gymnast, and not everyone can be an Olympic lifter. You know, it's determined that way a little bit as well. Well, let's look at a powerlifting example. I'm just going to slide over and get another model here. You mentioned a book that I wrote with Brian Carroll. Brian Carroll had 2 world records in squatting. He'd squatted over 1,000 pounds over 50 times in national, international competitions. All of these models that I'm going to show you have been built by a company called Dynamic Disc Designs, and they're absolutely fabulous, have tremendous biofidelity. And so the nucleus, or the gel inside the disc, has been dyed blue, and this vertebra has been made clear so you can see. So if you look down the hole and I squeeze, do you see the nuclear gel squirting up through the fracture inside that you can't see into the vertebral body?
Yep.
So there is an overload of compression. After you lose the ability to contain the nucleus, the disc flattens down a little bit. So now we have to talk about cascades of injury. Excuse me, that might have occurred in a stay-at-home mom. She goes to the gym and trains with a trainer, and inside 3 months, they're deadlifting their body weight. Mm-hmm. This is far too an excessive, far too much load in too short a time. That's just crossing the biological tipping point. It should take a few years to create that adaptation so the body's resilience is there. Failure to create that resilience causes a little bit of a disc flattening. Well, why does that matter? Here is a model of a spine, again, fully dynamic and very biofidelic. Consider this to be a normal disc, and consider this to be a normal disc in terms of stiffness. But this disc has had the fracture I just showed you. It's a very micro fracture, and do you know that most radiologists miss this? Mm-hmm. They're there to see on MRIs, but they don't report them. Watch. I'm going to bend the disc. Do you see how the majority of the motion is taking place at the joint that's lost its stiffness? Mm-hmm. Now, those micro movements are triggering pain. They're causing much more load on the posterior structures at that level. And what you'll find is a couple of years later, there's arthritic spurs that have grown not at this level, but at this level. And that's the body's attempt to stabilize that joint, but now the nerve roots have a smaller space to go through. The ligaments have hypertrophied around the facet joints. In other words, there are many people who say, oh, back pain is non-specific, or we don't know the cause of back pain. My answer to that is they haven't studied the pain pathways well enough yet to achieve that level of mastery. Here might be another one. Here is a disc that's a bit flatter, so it has a big bulge all the way around it, and on top of it is a smaller bulge. So it's a little bulge on top of a big bulge. But now this would be very typical of your older patient, and they may have been given the diagnosis of spine stenosis. So these nerves, the spinal cord and the nerve roots that we see, they move up and down the spine. So when I look down and the person says, oh, that just gave me numbness in my toe, what they did was they pulled tension on that spinal cord. Well, do you see how the cord, this is a better model to show, with hip movement and neck motion, the cord moves up and down the spine like this. It's always flossing. But if the disc becomes a bit bulged or the ligaments grow due to a bit of arthritis, as an example, the ability for the nerves to flow through the spaces get a bit compromised. It's almost like a carpal tunnel syndrome in your back. And people will say, yes, well, when I look down and flex my hip, I get terrible hamstring pain, which is sciatica, or their frontal thigh, which is a femoral nerve root, might go to sleep. But here's the interesting thing. Just observe now. There is the nerve root flossing up and down. And all I'm going to do is flex the spine a minuscule amount, and you will see, oh, the nerve is now locked. It won't move. Let me bend it back a little bit. all of a sudden it starts to freely floss. So that's when we get into, with those particular people and their particular pain cascade, if we teach them a small postural adjustment, all of a sudden they can do nerve flossing procedures, play different sports, and become resilient again. And then there are those who say, well, am I ever going to be robust again? And I tell them stories. Well, we've got players in the National Hockey League who have disc bulges. Do you know, Scott, they play in the National Hockey League when the trainer ties up their skates before the game. Because if they had to tie up their own skates, they would irritate those who had a posterior bulge, and they become so symptomatic they can't play the game. But when they avoid that trigger because it's known to them, it's explained, and now they've come up with a very evidence-based strategy to avoid that trigger, and it unleashes them. And I know you do this with your patients, and you've certainly done it with yourself for years. So the knowledge that comes is fabulous. Do we have time for just a couple more concepts that came into my mind? Yeah. So the next concept is, you see, the key to all of this is in the assessment. So when you give a thorough assessment to your patients, you can converge on recognizing the patterns. You're good at, a good clinician is a master at pattern recognition, and that allows them to target the intervention. So not everybody needs mobility, not everybody needs stiffening and stability, not everybody needs hip stretches or whatever the case may be, but some people will. Some people will need all of those things. It's a matter of matching. And the whole mega trend in medicine is towards precision medicine. And that's what this is, really understanding the mechanism of the pain pathway and addressing it appropriately. What is so interesting, and this might be a bit of homework and a bit of fun for your viewers, but on YouTube, there's the World's Strongest Man competition. If you go back to WSM, World's Strongest Man 2018, they have one of the events where the fellows had to squat 750 pounds for repetitions, and more repetitions wins. Well, every one of them found their failure repetition. Some are, say, between 12 or 17 reps typically. Watch the repetition before, you can find the professor who failed to turn his phone off. I'm sorry about that. Anyway, look at the repetition before the failed lift. Every single time the mechanism was revealed, if you know what you're looking for, a little bit of instability occurred. They lost stiffness and they lost control. So they would descend under the apparatus, the jig, squatting, and then on the rep before they failed, you'll see the hips slid out just a little bit, or the spine just bent just a little bit. And what the brain does when it detects this, it's a true instability, a loss of control. The brain shuts down the neural drive. So movement starts as a thought, and that thought is converted into a series of nerve impulses. The denser the nerve impulses, the more the strength, obviously. So you need a tremendously dense neural drive to win a strength competition, but the brain will shut it down when it detects joint instability. So you'll hear the coaches, and for the kids that are listening here, when the coach says, keep good form, don't get loose. When you get tired, keep good form. Not only is it a strategy to avoid the stress concentration of poor posture, it's also a very powerful performance enhancer in densifying the neural drive and keeping that strong so your brain doesn't shut down the drive. And that's when, they say, well, it's psychology, you will yourself to win. Well, it's a little bit more than that. There is a biophysical element to that strong thought creates that dense neural drive, keeps good form, discipline, setting apart from the winner from the loser. So sorry for the length of that, but it was a huge question that you asked.
Well, and I appreciate you digressing and going into those things, because those are questions that, as a clinician, I hear all the time, but also that many people don't really have awareness to those points. So I think it's important you address those. And I think that if you're a listener who, if this is your world, right, and if you've dealt with a spine injury, or if you're trying to do everything you can to protect yourself or your child, take those points to heart. Because many times there's a big lack of awareness as to, the way that, number one, people will fail, and the importance of a failure awareness, but also how back injuries occur and what positioning and these little cues that you can use with a skilled clinician to understand how to go and protect people when they are injured, but also the importance of using them as they rehabilitate from an injury as well. So, Dr. McGill, one of the things I think that is a common misconception, and you probably hear this a lot, I know I've heard it a million times, is people come in and they'll say things like, "Doc, I threw my back out." And, I'd like you to discuss and spend a moment talking about the way that spine injuries occur, instantaneous versus over time.
Yeah, I certainly appreciate that question. Well, when someone says I threw my back out, you've given me the first clue in pattern recognition. If I could follow up with some questions, you mean you had a good day before this happened. In other words, you might have had a good 3 months before this happened, and it might have been something as benign as you reached forward and flushed the toilet and it felt as though someone threw a knife in your back. Mm-hmm. Well, that is the pattern of discogenic pain. There aren't very many other possible candidates where that could occur. So they've probably got what we call a dynamic disc bulge. Mm-hmm. And as you flex, and if you have an existing delamination in the collagen, I hope you can see this. Do you see that little red mark? Yep. Of the collagen? Now watch, I'm going to flex the joint forward, and you see the bulge coming out of there? Yep. Yeah. And then it will resorb if I can then load the spine in an upright posture. The whole disc sort of bulges, but it doesn't create the hydraulic effort posteriorly. So you can see these dynamic fissures, as we call them, through the collagen posteriorly on an MR. But again, the radiologists haven't kept up with the science, and so they're not able to link that as a mechanism. So there's just a little bit of a start when someone says, well, I threw my back out. I'm already starting to begin to put together the pattern and what we need to do. So if they did that flushing the toilet, if we taught them squat 101, or you're from Ohio, every kid from Ohio knows baseball. Go out and play the shortstop position, pull your hands through and hinge with the hips. But that person with the dynamic disc bulge, if they did that to flush the toilet versus doing that, that allowed the mechanics to cause that. Now, does that matter for everybody? No, of course it doesn't. But for those who have the existing delaminated collagen, that really matters. So when you say injuries occur acutely from one incident, or are they from, should we say, cumulative trauma? Well, again, the answer is both. You see it both ways. And the best analysis or discussion point would be injuries cluster around specific sports. Mm-hmm. So if I said to you gymnasts, so think of all the young girls you've had over the years participating in gymnasts, what would you say you probably would expect if they arch back and they say that causes my pain? What would you say is the injury mechanism or pain pathway?
Well, in the vast majority of the young women I've dealt with that, it's been joint versus disc. In many cases, it's also been spondylolisthesis.
Perfect. So that's exactly where I was headed. Yep. So if I said, here's 10 girls gymnastics, they have extension-driven back pain, you will find the majority. Or if I said, who gets spondylolisthesis? You're going to tell me you're young adolescent, young teenager girls doing gymnastics. Yep. You might get the odd baseball pitcher. In other words, there's a reason. It's stress-strain reversals
Yep.
on the pars bone, which is this little bone here that starts as a stress fracture and then finally breaks, and you get a forward displacement of the upper vertebra. So there you go. There's a perfect example of a cumulative trauma. Well, the person might say, well, I'm getting a little bit of a grumpy back, but boy, that was the event when I landed off the high bar and, whatever. That was really just the culminating event, or the straw that broke the camel's back, of them going past the tipping point. So you recall our first opening principle. They overdrove or went past the tipping point. Cumulative trauma was there, and the fatigue stress fracture finally became a full fracture and highly symptomatic. But now let's go to your career as a football player or as a wrestler. You might have had over the years, we've seen a few who've been cracked in the back, heavy collision and extension or motor vehicle accident. All of these, a crash in downhill skiing. I had one of the great World Cup skiers here a couple of weeks ago who had fallen in a crash. And so the rehab, if it's a cumulative process, the best thing to do is to stop the cause, obviously. But if it's a crash, how do you stop that? That's the sport, and that we just put that into the bad luck happens category. And then, but the rehab is quite different. So to heal a spine fracture, and excuse me, can you believe the doctors missed it? I was the one who found the fracture, and they'd already been to a few of the best orthopedists and sport physicians and whatnot. They all missed this fracture, but they couldn't figure out why she couldn't get down into the racer's tuck. Wow. Yeah. So, or, you get a rackets player, like a tennis player or a squash player, or maybe even a soccer player, and they've got a loose pelvic ring now because the trainers have had them do excessive numbers of deep loaded split squats or lunges, Bulgarian split squats. So when you do a Bulgarian split squat, which is you put one foot up on a box and you squat like this, but that causes mutation in the pelvic ring. This half rotates forward, this half rotates back, and you can see the micro movements that occur right at the SI joints. Well, a little bit will build you. Too much will cause so much laxity. You now have a painful pelvic ring, and you'll see the sacrum is like an arrowhead. It drives down with compression, and now they say, well, going for even a light jog hurts, or climbing up the stairs. So anyway, the trick is to recognize the patterns, stop them before they really become symptomatic and need a much higher level of addressing. But if, we all cross the tipping point, that's just life. Then it's a matter of matching the intervention to the mechanism, and it's a very precise mechanism. It's not non-specific back pain. Then you have a much better chance to have a successful outcome with a matched rehab.
Dr. McGill, obviously, talking to the moms and dads out here, many people live in general fitness land. And as you know, right, in general fitness and in some folks in sports performance, many trainers still advocate high volumes of sit-ups, crunches, V-ups, knee raises, Russian twists, toes to bar, so on. What would you say to an athlete or a parent of a young athlete if this is the case in this situation?
Well, the answer to that question is always two words, and that's it depends. So what really builds one young athlete will tear down the next. So you have to ask yourself the question, what is the robustness of this person that we're taught? Where do they slide on the spectrum? And some parents, unfortunately, aren't real. They think their young son is the best at whatever that the earth has ever seen. And they're under a grand illusion. And there are other parents who don't recognize the brilliant capacity and God-given gift that their child has. It goes both ways. But It's very situational and it needs a context. But let me give you some examples now. Before we went on air, you asked had I ever been down to Ohio, and I said, well, a few weeks ago I was in Columbus, and I just had a wonderful training session with Matt Brown, Matt the Immortal, they call him. He's a welterweight from the UFC. He's had a fabulous career. And, if you take a typical MMA athlete, depending on their training, but if it's a karate background or something like that, they might wake up every day and do a few hundred sit-ups because of the tradition of the sport. And this works fine. They're okay until they're 23 or 24 years of age. They've got their UFC career going. And then what happens, they've done so many repetitions that the spine becomes painful. They crossed the tipping point. And what's so interesting is the thicker or the heavier the skeleton, the faster the pain comes. The thinner spine will be better at golf and mobility and that kind of thing, but they won't play middle linebacker in the NFL. It's just biologically, the cards are so stacked against you at that elite level, you're not going to make it. But so they come to me and they say, well, I can't train jiu-jitsu anymore. I can't train, and I'm, a professional MMA player. And I'll say, well, tell me about your training. And we assess the mechanism of their pain, and we determine it is all flexion driven. And then I'll say, okay, instead of doing the curl ups, laying over a gym ball and doing, 600 of those every day, turn around and put your elbows on the gym ball with your feet on the ground in a front plank position. If you can see what I'm doing, there would be a front plank on a gym ball, and you simply do stir the pot. Well, you see, we've changed the flexion movement of sit-ups into flexion moment. It is still a tremendous flexion challenge as you're stirring the pot. Well, in MMA, what you will find is the athletes don't use this to flex the spine very much. They use it as a short-range stiffness spring to create a punch or to kick, and they snap down the hips and then unleash the leg as it flies through the air. That is using the core as a short-range stiffness spring. So do you see stir the pot? What is so fabulous is it restores their career because it takes their pain away and now they can train again. But secondly, they never realized it was now enhancing their performance. So that's when you get famous, when you can take injured athletes and not only take their pain away, but they reach a level of performance. And, some parents will come with a young athlete and they'll say, oh, is my kid ever going to be able to do this again? And, of course, not every injured young athlete is going to be able to reach this, but some of them will be so propelled by just creating a better training regimen that they are now performing better than they ever have. And that was I hope you appreciate the title of our book, Gift of Injury. Mm-hmm. So many athletes will tell you, we never set a world record till after we had a back injury.
Yep.
And the gift of that injury was the appreciation for science, never breaking form, allowing proper adaptation in their back, and that kind of thing.
I love that because I think that's really critical for moms and dads who've never heard that. Injuries, they stink. Been through a long time of it myself, but the respect that you get and the importance of form, technique, body awareness, not allowing yourself to break form, and understanding what those optimal positions are is really critical. So if I want to make sure that moms and dads, for your child, for yourself, take that to heart from someone who has lived it and applied it. That was a really critical piece for me, was when I grasped those. I always thought I was a form junkie. I always thought I had great awareness. But when I really understood what that meant, it changed the game for me, being able to get back to high levels of lifting and performing once I understood those principles. Sorry to interrupt you, Dr. McGill.
Well, no, of course. It should be a two-way. I don't learn anything when I'm talking. Anyway, But it just comes to mind, when I see a young athlete and they'll come in and they'll just slouch. Well, we always start off with a good interview, and I have a special couch for that and in front of the fireplace, and we really just relax and have a little bit of a talk so I understand the athlete. But I'll see them sitting in terrible form, and then they get underweight and they have great form. But I know what the problem is. All day long, they're training stealing capacity. But if they had better movement awareness 24/7, they would then be building more training capacity for when it really matters, and they're trying to create that adaptation for resilience in their body.
Yeah, that's tremendous. And that's a great point to take away, is that it's not just the training form, it's the other form, the posture, right? The maintenance of good form of body alignment, even when you're not under load, is so critical. And we teach that here all the time, but moms and dads, that's a critical learning point that, if you sit in flexion all day, don't be surprised if your back is going to get injured, because those things are over time, they accumulate on your body and they will break it down. So learning what's optimal body position for you or for your child is critical. And, we teach our kids about posture, but oftentimes it doesn't mean something until you think, God bless you.
Excuse me.
No worries. It happens. So, Dr. McGill, I want to move into something else, because in my practice, I've had the privilege over the years of caring for a lot of folks who are military and first responders, and your work is credited with the U.S. military for the first time in their history changing course away from their core training being towards sit-ups and flexion-based movements. I think this is a critical point, because what in making a change like that, there had to be enough evidence that was presented to them, and because of the amount of back injuries that they've seen over the years with their cadets, to make this kind of change. Can you talk a little bit more about that?
Boy, you've really you're starting to test my memory now, because we'll have to go back about 35 years where the start of that came from. Interestingly enough, it was the Canadian military that really led this movement, and it wasn't me that instigated it. They instigated it because at the time they were noticing that there's no predictability by the ability to do sit-ups or some of the other tests at the time and performing well on the battlefield or on the fire ground if you're a firefighter, or if you're chasing a bad guy down the street if you're a police officer. So that led this movement of what's called job content validity. And it was really resisted in the US, but in Canada, it became the only way to validly predict who would do well in certain types of military endeavors. So when I was a PhD student, my PhD mentor at the time was actually looking at this idea of transference and predicting performance based on specific tests. Well, another feature that the listeners need to know was that militaries have annual fitness tests to see if you're fit for duty. And tradition has always been speed sit-ups. How many sit-ups do you do in a certain length of time? Well, if you're a soldier and you have to pass a test, you're going to practice it. Well, that's where the interesting thing came from. It wasn't that the test was causing that much difficulty. It was that the people who were the most afraid of failing the test trained it even more. In other words, the most unfit ones were training speed sit-ups every day, making sure that they were going to pass. Well, that's the problem, and we've already had a discussion about the size of the spine matters. And, there are people that can do sit-ups with impunity, but they will be small, thinner-boned people who do not lift a lot of load. Mm-hmm. This is the magnitude of the discussion that we're going to have. So it matters what the other training exposures are, the architecture or the anatomy of their back, et cetera, et cetera. So Anyway, to bring us back on tack, it was the Canadian military who were noticing, and the medics and the physios and whatnot, that it was the speed sit-up training to pass the test that was causing a lot of these soldiers to have disabling back pain to the point where they couldn't load howitzer shells and do some of the heavy lifting grunt work. Well, that was that. They then created what was called job content specific fitness tests. So instead of doing speed sit-ups, they had to pick up sandbags and carry them and load tires onto trucks and real military tasks. A load carriage would have been another one with a lot of job content validity. Well, then the Americans recognized that, there was an awful lot of GIs returning from theater, battle theater, with disabling back issues. They were being sent home because of their backs. And as it turned out, it was them training and the way that they were training. And it was so interesting. We did a parallel study with the Toronto police force and the elite police officers. We studied them for 5 years. And we over that time, a few had some back injuries sufficient for them to lose time from work. What were the features about that person? Well, as it turned out, the most dangerous place a police officer could be was not out in the field. It was in the weight room. And it was the way, with the volume, the intensity, and the exercise choice that determined to a great degree if they were going to cross the tipping point. So we keep seeing this time and time again. When we couple that with the evidence we've been or the investigations we've been doing over the years just on cadaveric spines. Well, you can argue it's a cadaver and it doesn't adapt, and we all get that. But we were starting to see what happens when you repeatedly flex or mimic a sit-up on a spine. The collagen slowly gets a bit loose and lax and allows delaminations, as I was giving you the cumulative stress in a fabric, using my shirt example. But anyway, all of these things came together. So the first branch of the U.S. military was the Navy. And there were some influential people there. And again, it wasn't me. They came to me and said, what can you suggest here? And it was a slightly different experience in the U.S. than it was in Canada. But nonetheless, the Navy put their own evidence together of the incidence of things like disc bulges and whatnot being linked to the sailors having disabling back pain. So they didn't really go with job samples, though, because the argument would be, well, we don't have testing stations on ships. And we can't do some of the endurance tests that we found to be quite predictive of who would be resilient under load. It's on a ship. So they said, well, what's the most simplest task that doesn't require any equipment? So they went with the front plank holding time. Now, it's not as good. And you could argue that, well, if you've got a shoulder compromise, you will fail due to shoulder issues. And what happens? Some of the women will fail prematurely as well because of shoulder issues. Anyway, the story goes on and on. But that's a little bit of the story. And it continues on to this day in sport. If I was to say to you, look at the NFL Combine, everyone knows the tests that the NFL players have to prepare for to do well in the NFL Combine after they've been drafted and they show up. Well, you'll find that the predictability of who does well in the NFL is very poor. I mean, it's notorious on how some of the great ones, the ones who've had great careers, had really not impressive combine scores, or the ones who have the records in combine performance never made the league. So you would argue that the content validity is not very good. But obviously we've studied these sorts of things. The NBA does a better job. For example, the NBA lane agility test really does a much better job on who scores baskets and that kind of thing. So it's not like a 30-meter sprint. It is agility, it's lateral shuffle, it's the drop, step, turn, and all these kinds of things that I could tell you stories about the NHL as well. What really predicts who puts pucks in the net? But my point is now, by the same token, those are all performance markers. There are markers for injury resilience. And one might be side plank holding time. Now, I don't think I've ever reported this outside of my own textbooks. But at one time, I was doing a little bit of consulting with 3 or 4 NHL hockey teams. And that season, we had 5 sportsman's hernias or torn abdominal wall. It was either external oblique or internal oblique, never transverse abdominis. And we had the scores from those players in preseason for their side plank holding time. Wasn't it a coincidence that all 5 of those players who got that injury had side plank holding times less than 1 minute? Now you ask yourself, I'm an old man and I can hold mine longer than a minute. So are they that poorly trained in their core that they couldn't hold half a minute? Well, we've noticed that time and time and time again. If you can't hold a side plank for 1 minute and you're going to perform well in sport, you've just increased your risk of injury. My colleague Jack Callahan at the University of Waterloo, a very good professor and investigator of these things, he just took people and how long could they stand? How long could they do different tasks before back pain started to creep into their back? Those with holding times on the side plank of less than a minute broke to pain much sooner. So, you can look at occupational examples, etc. So some people say, well, where did the evidence come from? Show me the paper. Well, it is years of investigations, many, many papers and studies from different perspectives. It was like smoking. You can still argue to this day that your grandfather who's 90 smoked every day and never got cancer. But does that mean that there's not a link? And there are people who will still argue based on that rationale. But you have to say, on average, smoking increases your risk of cancer. But it's not that difficult to argue against it if you just pick out a few studies and try. So it's the grand effort that changes military policy, which is a huge thing to do. And it's really multi-perspectives that come into it. But it was primarily driven by the military themselves, and then going and seeking a little bit of external expertise. So that's the big story anyway.
Well, thank you for sharing that with us, Dr. McGill. And, I want to note out here for our viewers here who can't see this, in the back, there is a logo that says backfitpro.com. And I want to discuss this for a moment because the McGill method has become something that is implemented by doctors and clinicians, nationwide and now worldwide. And, the things that you teach are being implemented in a number of different in a number of different ways, but you actually have a tremendous level of resources available for people that are back pain sufferers on the website. Would you mind telling our viewers about some of the resources available to them, whether they're looking to help themselves or looking to find a clinician on your website?
Certainly. Thank you for the opportunity. If the person is experiencing back pain, I wrote Back Mechanic, the first book, for those people. It's written in a lay public language. And I should say, it was shopped around by an agent to different publishers, and they said, this book's never going to sell because you have to have a title, cure your back pain in 5 easy steps. And I said, I can't do that because it's a lie. It's not possible. So I wrote that book and we self-published it, but it starts out with a self-assessment to take people through a little bit of a self-assessment so they can discover their own pain triggers. And then based on their scores, they know what to stop doing, which is most important, stop the cause, and then what to do to build the foundation for the activity that they want to do. Well, that will help, believe it or not, 95% of people. And we track that. We've followed up with every patient who ever showed up at the university clinic. But there will be those who are a bit stubborn. They need a bit more expertise in determining their cause. So at that point, the first book I ever wrote was Low Back Disorders, and I wrote that for the medical community, people like yourself. And then I say, all right, well, you've got to go to a clinician who understands and is quite an expert in back disorders, and that would be the textbook for them. The most recent book I wrote with Brian Carroll, which really tells a wonderful story it was called Gift of Injury for a reason. It was truly a gift. But it's the story of biology and mechanostimulation, but psychology, sociology, and everything else intertwined, because chapter 1 starts out with Brian sitting in the parking lot of the hospital that he's just come out, and the surgeon telling him, we don't think you'll really be out of back pain. He had a horrible spine fracture and 2 crushed discs. And we show this, the MRI in the book. It's horrific. I don't know if you've seen the page. It's a horrific injury. And he's sitting there with a gun, and he's saying, well, I am the best squatter. And at that weakness, being in such terrible pain and thinking that this injury had stolen his life and his identity, he was wondering what he should do with that gun. Well, fortunately, he didn't do anything except put it down. But it was the story of me seeing him recognizing these things and organizing 1 year of what we call bone callousing, which is a very specific mechanostimulation, just through strategic exercise and rest, recognizing what needed to be adapted through overload. But, he talks about, being kidded by his old mates that he's doing these funny little exercises and whatnot. Can you think of the social impact and the psychological impact of all of that? But he had this innate toughness, not only the physical toughness, but the mental toughness. And he did this procedure. I wanted him to do it for a year. He actually cheated. He did it for about 8 or 9 months. But nonetheless, then he switched to performance training and came back and won the Arnold's powerlifting for a couple of years after that. So these are the books that are on BackFit Pro. And we have a few videos. There's access to podcasts that I've done that tell stories. And then your question on how to find a clinician. Well, we list on there people who are certified in the McGill method who've taken our courses and passed an exam, but I haven't seen patients with them, so I don't actually know. I know they're trained, but there hasn't been a final audit there. But then we list the master clinicians, and these are people I've trained. They know better than anybody how to read MRI, how to read the patient, really do provocative testing to understand the mechanism of the person's pain and what to do about it. And those are the people that we refer patients to. So that's a little bit of what they can find on the website. Great. There's a few testimonials from some pretty impressive athletes as well. Obviously, I'm not allowed to mention the athletes who I do work with, but some of them volunteer and say, if you want to tell my story to help other people, go ahead. But obviously, if you're making $10 million a year, you don't want anybody to know you've got a back problem. So that's highly understandable.
To say the least. And you also have a newsletter.
This is Tico.
Hello there, puppy.
Anyway, yeah, we're slowly developing that. That takes a lot of work. And like you, between seeing patients and whatnot, those are always the things that somehow don't get the highest priority. But anyway.
Yeah, but there's lots of great resources available. And, if you're dealing with back pain yourself, make sure you get the books. Dig in and just understand that. And, if you really do need to go and get care, go and find a McGill master certified clinician so that you can know that you're getting the best of the best. Because I will tell you, moms and dads, number one, if this is something you're dealing with an injury, they are going to be the most highly qualified there are. If you want to make sure that you are protecting yourself or your child, then get to know these folks, because these are the people who will be the most qualified to protect your young athlete or you as an adult athlete, so that you can have a long, successful, and, God willing, pain-free career. So, Dr. McGill, I thank you so much for being a part of the podcast today. It's been a pleasure getting a chance to have you on here. And thank you for sharing your knowledge, wisdom, and experience with our viewers. And moms and dads, make sure that you check out backfitpro.com. And we'll have all of the links to Dr. McGill on social media, as well as his website, in the show notes here following the episode. Thank you all very much. God bless, and be elite. Thank you for listening to the Growing Healthy Families podcast, the world's #1 source for health education. Make sure to go to iTunes or wherever you listen to podcasts and give us a review. Make sure to follow us on social media at the links listed in the show notes, and let us know what area of health you are struggling with, so we can get you and your family on the road to epic health.